Hi everyone, Dr. Tevlin here. Today we're going to talk about how do you know if you have neuropathy. So patients would typically come into our office and our doctors will go over your history, any red flag questions like do you have diabetes, have you ever had chemotherapy. There's over 100 reasons that cause neuropathy and we see darn near all of them in our office. And when you come in, we'll first do that history. Then we'll do what's called a sensory exam and a thermoscan. The sensory exam is basically going to give you a number on a scale of 0 being normal to 100 being complete sensory loss, where you fall along that line. Okay, and that's going to be your baseline. By the time people come in here, they're usually already in moderate to severe nerve damage and even permanent nerve damage. So it's best as soon as you feel symptoms coming on, get checked out, don't ignore them. It is your body's warning signals to come in and get that checked out. So we have people describe their symptoms in all different kinds of ways, from tingling, numbness, burning, pins and needles, feel like their feet are squishy, or they're have like edema or swelling in their feet. And we see patients start with it in their feet typically. It can start in one foot and then go to the other. And then eventually, if it gets worse, can even get into the hands. And the hands are typically affected last. And we always tell people there is a circulatory component to neuropathy. As our nerves are starting to die off, they lose their blood supply. So hands are closer to our heart. So we typically see those getting affected last. Doesn't mean that it can't happen in the reverse order of people having neuropathy in their hands first and then going into their feet, but that's just kind of the typical pattern we do see. Our testing, it is not painful, and it's going to give us a number to basically go off of when we start doing treatment, and then we can show your progress. The other test we do is a thermoscan. Again, when our nerves are starting to lose their blood supply, we're able to pick up that discrepancy on a thermoscan from what normal should look like to what our patient's feet are looking like. Again, we use that during our treatment progress. Every 90 days we're retesting and taking those pictures, and we can actually see that and visually watch that get better, which is really cool for patients. So if you're having any symptoms of neuropathy, I always tell people they've probably been there even longer than you think they've been there. If someone says, oh, I've had it for 2 years, it's probably been there even longer, because our body's really good at adapting to so much sensory loss before it can actually perceive there's a problem. So until it starts affecting safety, future ability, freedom and independence, we can kind of push it back until the symptoms get too bad and they become permanent. So don't wait, get in here, talk to our doctors and see how we can help you so it doesn't become a permanent problem, and the sooner we can catch it, the quicker it's going to be to get rid of it. So I hope that helps, and we'll see you soon.